So we're just gonna wait until it's on live. So we're live. We're
Mhm.
live on Facebook and on YouTube. So hey everybody, good afternoon. I am back. Back to doing the podcast and everything. I'm super excited about tonight, this afternoon, the great discussion we're gonna have. So hey everyone, I'm Hope Harmon. Thank you so much for joining us. At Act for Change with Hope Harmon. I'm a change agent, elected official, and an advocate for everything that I feel is right. Living in rural South Georgia, and I believe that through honest and open conversation, that we can help to change mindsets, perceptions, and call people to action. So we're so excited to have you here with us this afternoon. For everybody that's on the live, make sure you share, make sure you tell your family and friends to tune in. Everyone knows that I'm a big advocate of mental health. I think that mental health is wealth. I think that your mental health is just as important as your physical health. So going forward, I'm going to be doing a lot more, having a lot more professional mental health professionals come on to talk to us about things concerning mental health. And we're just trying to break some stigmas tonight associated with mental health in medicine, which I think is very important. As I've been on my mental health journey, I've noticed that some of the stigmas that are associated with people who do need medicine in order to be successful on their mental health journey. So I'm really excited to have family nurse practitioner Kayla Potts here with us today. She deals with the medication part of mental health. And so we're just going to jump right into the questions. If you do have any questions that you would like to ask Kayla, please just drop them into the chat. And if she can't get to them tonight, I'm sure we can always do like a follow-up post to answer the questions, or you're welcome to if you have a question that you don't want to ask on the live, that you can always inbox me. That's perfectly fine, and I can ask the question. So we're gonna, like I said, we're gonna jump right into it tonight. So Kayla, can you tell us more about what you do as a family nurse practitioner working in the mental health field?
Sure. So, my role is to assess, diagnose, and treat mental health needs of patients. For instance, I treat patients with anxiety, depression, sleep disorders, PTSD, suicidal ideations, and bipolar.
Wow. Wow. So, what are the biggest stigmas that you have seen being in this profession associated with medication and mental health?
hmm So I have seen some people come in and they have a fear of being labeled as crazy or weird. And I have seen some people who battle with depression. They say they've been like stereotyped as being lazy, but in actuality, a lot of people who suffer from depression, they're often tired. They have no energy or motivation to complete simple tasks. And sometimes the stigma doesn't come from other people; it comes from within yourself.
Mm.
Some people tell me that they've never received help just because they felt like seeing a therapist or being prescribed medication was a sign of weakness, and or they felt like they could control it without seeking help.
Wow.
And sometimes I do see people come in and they say, I feel like I've been struggling with anxiety and depression for a while, but I never received help because of my religious background. I've always been told to just pray about it. But it's okay to pray and talk to a professional at the same time. I mean, just like you see your primary doctor to treat medical conditions such as hypertension, diabetes, seizures, strokes, and other medical conditions, you should always receive, don't back down when it comes to your mental health. You should never neglect your mental health. And sometimes, some people may think they have high blood pressure, but if we get the anxiety under control, you'll see the blood pressure come down. So a lot of the physical side of it comes from the mental health.
Wow. I always tell people like pray, but see your therapist
There,
too.
mhm,
Like I am
exactly.
huge on that. Like we gonna pray, but we also
Mhm,
gonna see our mental health
right.
professional. And just like God gave us teachers, He gave us in the Bible it says He gave us doctors, He gave us teachers, He gave us preachers. He also gave us mental health professionals.
Exactly.
So I love that. So typically, how is medicine prescribed to patients? Is it a doctor's suggestion, or do you see patients coming in and asking for it? Like, how does that typically go?
Hmm. So, and I would say medication may not be for everyone. Some
Hmm.
patients can come in, they may just need talk therapy. But typically when they do come in, we do screen them. And we go medications primarily prescribed based on the symptoms that they're having. We look at other health conditions they may have. For instance, if a patient tells me they have a history of seizures, I wouldn't prescribe Wellbutrin, because Wellbutrin can cause a person with a history of seizures to actually have a seizure. If a patient come in and they tell me that they're pregnant or they're looking forward to conceiving soon, more likely I would prescribe a medication called sertraline, because that is the safest medication to take during pregnancy. But I would need to know what medications they're already taking, because we certainly wouldn't want to prescribe a medication that could interact with a medication they're already taking. And some medications can actually be used to treat more than one problem. For instance, the Wellbutrin that I mentioned earlier, Wellbutrin can treat depression. It also helps with someone that's trying to stop smoking,
Wow.
and weight loss. Weight loss is another common reason why a lot of people like the Wellbutrin.
Wow. Like, okay, wow. I never thought about that. Like how medicines can have
Mm-hmm.
more than one benefit,
Right.
So I've just never really thought about that. So that's really good to know. So also, how does a person know like when a medication maybe is not for them? Like what are some things they should look for once they're on the medicine to know that maybe it's not for them?
So if you feel better right away, but it doesn't last long, or that could be like a placebo effect. Or if your
Mhm.
mood is still low, even after the 6 to 8 weeks of taking the medication, or in the course of your depression worsens, that can all be signs. Okay, this medication is not for you. We may need to look into trying something different. If you experience symptoms such as like fevers, aches, sweating, fatigue, confusion, dizziness, muscle twitching, that also can indicate that the medication may not be for you. But just keep in mind, medication do work differently for different people.
Mhm.
But it is common to have some side effects that are mild, such as like nausea, headache, drowsiness, because it's just your body trying to get adjusted to that medication. But if you have, symptoms that, that's not going away and it just, causing more harm, of course, we would look into trying something different. And I will say, inherited traits do play a role in how antidepressants affect you. So if you come and tell me like, hey, I have a close relative that was on this medication, 9 times out of 10, I would probably try to that medication first too, because if it worked well for that close relative, that may be a good choice for you as well.
Wow. So it's really important to let your whoever's prescribing the medicine know what's going on with you while you're on the medicine.
Exactly.
And
Exactly.
so, that's a kind of a form of like self advocating to let them know what's going on. So if it's not for you, then they can find something else. And this
Mhm.
just goes back to don't give up so easily. Just
Right.
talk to your medical professional and see if there's maybe something else. But I
Because it does
also
take time. I would say
right.
it does take time for the medication to work. Like typically, it does take at least 4 to 6 weeks, but it can take up to 8 weeks
Oh wow.
for the medication to actually work. And I highly recommend patients to still follow up with your primary physician for like regular routine lab draws, because certain medical conditions they can mimic depression and anxiety. For instance, if a patient tells me, look, I'm tired all the time, I have like unexplained weight gain, slow movement, thought process, that could indicate that they may have an underactive thyroid, which is hypothyroid. If they come and tell me I've been irritable, I have rapid mood swings, unexplained weight loss, fast heartbeat, that could indicate an overactive thyroid, which is called hyperthyroidism. So you still need to, follow up with your primary physician.
Oh, wow. Okay. So I constantly see this debate a lot about like natural versus medication. You
Mhm.
have a lot of people who think that, oh, my symptoms are just going to disappear naturally. I'll just get better. So I just want to know, why is it important for people to take the medication part of mental health seriously?
So research does show that 70 to 90% of individuals have a significant reduction of symptoms and improved quality of life with a combination of medication and psychosocial treatment. And some conditions that that are just more severe, like schizophrenia, it does require medication. And I would say for those that are prescribed medication, it's very important for them to take the medication as directed and not to miss any doses, because missing doses, it could create, more issues like flu-like symptoms, dizziness. So it is very important, to take medication as prescribed. And like I mentioned earlier, medication may not be for everyone. Some people who have like mild to moderate depression, it could be something simple as exercising more, or doing yoga, meditation. They may have a vitamin D deficiency that's causing, depression. They just may be something simple as taking a vitamin D supplement or receiving more sunlight.
Okay. So, how can we better educate ourselves on the medication that's being prescribed? So, if a person is on
Mhm.
medicine, how can they better educate themselves on what's being prescribed to them?
So I would say, don't be afraid to ask questions. Don't be afraid to ask your provider, that's prescribing the medications questions. And just do your own research too. A lot of the evidence based resources are out there, like up to date, PubMed, and more likely most of the websites that ends with .edu or .gov, those are more reliable resources to follow.
Okay. So I know, this is during the holiday season, grief and loss is pretty overwhelming for people.
Mhm.
Is there anything you can tell our viewers as maybe words of encouragement or advice to continue or start their mental health journey as it relates to grief and loss?
Sure. Yeah, so I would say it's okay to seek help for mental health. Asking for help is not a sign of weakness. And just to know, it's okay to do things that make you happy as well.
Mhm.
Sometimes we can get bogged down like making other people happy, doing other things, but and neglecting our own selves. So it's okay to take out time to do something for yourself. I will also say surround yourself with people who love and support you, and just allow yourself to grieve. Everyone has different way of grieving, and sometimes you may want to do something in their honor, even if it's something as simple as like listen to a favorite song or watch their favorite movie. Some people like to give donation or do community outreach project during that time. But I will say, if the grieving, is beginning to inhibit you from like functioning from day to day, then it's okay to go ahead and seek mental health profession.
That's really great advice. That's really, really great advice. So I just want to thank you so much again, Kayla, for coming on tonight, and having this discussion. I think it's really important that we continue to break the stigmas associated with our community and mental health as a whole, and of course, medication as well. And for everybody tuning in, I'll be back next week. We're going to be having a discussion with Hayden Hamby. She's a mental health professional that is going to be talking to us about coping with grief during the holidays and children. I think sometimes the children are overlooked during our grieving processes, and children also grieve as well. So Miss Hayden is going to come on and have a great discussion with us at 4 o'clock next Sunday about grief in children. Thank you so much, everyone, for tuning in tonight. Be sure to follow my advocacy page, Kasera's Voice, as we continue to seek justice for my sister Kasera, Aviana, and other of those who have lost their lives far too soon due to domestic violence. And be sure to subscribe to the podcast as well. So thank y'all again. Make sure that you like, subscribe, and share. And thank you again so much, Kayla. We really appreciate it. Everyone have a
Thank
great
you.
night.
All right, have a good night. Thank you.